This seminar is for educational purposes only. It is not a substitute for professional medical advice or treatment. Consult with your medical provider for medical advice or treatment. Although the presenters try to keep the information in this seminar as accurate and timely as possible, the speakers and Mather Hospital assume no duty to ensure the seminar is error-free. The speakers and Mather Hospital are not responsible or liable for any claim, loss, or damage resulting from you viewing this seminar.
Good afternoon, and thank you for joining us. Today's webinar is brought to you by the Back and Neck Pain Center at Mather Hospital, and today we'll be discussing anxiety-related back pain. At any time during the presentation, please feel free to enter any questions you may have using the question and answer feature at the bottom of your screen. We'll answer as many questions as we can within the time allotted once the presentation concludes. Your questions will remain anonymous. Today's presenters are Dr. Ben-Eliyahu, Caitlin Conville, and Melissa Hafner. Dr. Ben-Eliyahu is the Administrative Director of the Back and Neck Pain Center at Mather Hospital and the Director of the Mather Chiropractic Collaboration Program. He has advanced certification in sports injuries and pain management. Dr. Ben-Eliyahu has been in private practice in Selden, New York for 34 years, where he directs an integrated and collaborative spine and musculoskeletal practice. Caitlin Conville is a nurse practitioner and program coordinator for the Back and Neck Pain Center at Mather. She received her Master of Science from Stony Brook University after completing their Family Nurse Practitioner program. She joined the Back and Neck Pain Center from the inpatient side of Mather Hospital, where she worked in orthopedics for over 4 years. Melissa Hafner is Assistant Director of Mather Outpatient Physical Therapy. She received her Bachelor of Science and her Master's degree in Physical Therapy from Mercy College in Westchester, New York. She's worked at Mather as a physical therapist for 14 years. Dr. Ben-Eliyahu, you can go ahead and get us started.
Good morning, good afternoon, everybody, and thank you for attending. So today's webinar is on the relationship between back pain, including neck pain, and stress. Pretty timely considering what we're going through with this pandemic. However, even pre-pandemic, stress was always a big factor in people who develop chronic back pain, even acute back pain. So we're going to talk about a bunch of things today, including how stress is related, how the physiology works, once this develops, things that you can do to help attenuate it. And we're going to go through different types of treatment. We're going to go through posture, nutrition, stress techniques that you can do at home, and then what to do if none of that is working, who you can reach out to. So stress and back pain, very, very causally related. In a recent study, 29% of United States adults believe that stress and anxiety was causing their neck or back pain. And in a very recent study published in General Hospital Psychiatry, patients with stress were found to have twice the amount of time for chronic back pain, meaning that people who had stress were 2 times more likely to develop back issues and neck issues. So back pain, it's really a pandemic also in society. 80% of Americans will experience back pain at some point in their life. 10% of the world's population is currently suffering from back pain. That's a pretty big number. In a recent study in Lancet, back pain was found to be the #1 cause of disability worldwide. It's a huge expense. Women suffer from back pain more than men. Lower back pain generally happens more as you get older or based on how your activity levels are. It could happen younger. And it's very, very stressful, not just emotionally, but also physically. And we're going to talk about all those things in this webinar. Next. So why do we develop stress, anxiety, and then eventually depression? Well, I think this picture and this graphic pretty much tells it all. You can see all the different things that can contribute to stress. If you read it on the right, you know, some of the things that can contribute to our stress and anxiety are pretty much just part of living. Busy schedule, financial issues, you may have lost a job, especially in this pandemic. Financial issues and job stressors are pretty common. Family and relationship issues, societal issues. I mean, the list goes on. And generally, people have more than just one. So it doesn't even just mean that just one of these can cause it. Many of these things can contribute and will have a cumulative effect. And we'll talk about how this type of mental status can actually have a physiological effect on your body. Next. So here, for some of you who aren't familiar with or don't remember biology and physiology, we learned long ago in science that there's a particular response that we all have, whether it's human or mammalian, and it's called the fight or flight response. And basically what that means is if something happens, your body reacts to that stress by producing, through the sympathetic nervous system, a hormone called cortisol. So cortisol, when it accumulates in your body, can have a significant effect on muscle tension, and that muscle tension can actually affect how it affects your skeletal system. So if you have a lot of muscle spasm and you're very tight like this all the time, it can pull on your neck, it can pull on your shoulders, and eventually along the course of time, it develops pain because it's actually causing muscle spasm and trigger points, and it's changing your posture. It actually creates pull on the joints, which now trigger pain. And then the more stress you have, the more that happens, the more that the muscles tighten up, the more waste products they produce, then eventually this just becomes a very vicious cycle, as you'll see in a second. Next. So it's not just our back and neck that gets affected. You can take a look at this chart in this particular graphic and see that stress affects everything. It affects your head, it can affect your heart. You know, you can think about people who are developing heart attacks. You know, they're in tons and tons of stress, something very stressful happens to them, and they can have an immediate heart attack. Stress affects our intestines as well. You know, we have muscle in our intestines that can be affected by stress. It affects the reproductive system, it affects our immune system, and you can see that it affects almost everything, even the skin. So this just doesn't affect your back and neck and your muscles, it affects almost every system within your body. So it's important to learn how to handle that. So here's the pain cycle. So if you look at the top right, you can see that the psychological stress, you know, that's the first thing that generally occurs. Although we could have probably put 2 arrows between psychological stress and pain, because the more pain you're in, the more stress you have, the more stress you have, the more pain you have. But if you follow this clockwise, and we assume that stress and anxiety happen first, it can definitely cause pain because, as I said before, muscles guard. Now picture a muscle kind of connecting from your neck down to your shoulder. Picture that being a piece of rope. So if that muscle guards or shortens or becomes very tight, like a rope, it pulls. That now restricts range of motion. So you can't move as normally or freely as you would in all those planes of range of motion. After a long period of time, between muscle guarding, the restricted range of motion, eventually that muscle becomes weaker. You don't use it as much, so the muscle atrophies, which means it gets smaller and weaker. It doesn't have the tone or the width that it normally would have, and now that leads to decreased function. So you can follow this cycle. With decreased function, you have more stress because you can't do the things you like to do. You can't function as well. You may not be able to work as well. So you have more stress, and there's the vicious cycle. Round and round the merry-go-round it goes. So we're going to hopefully teach you some things that you can do to help break that cycle and get off the merry-go-round. So getting back to back pain, stress and tension can cause stiffness in the muscles and in the shoulders of your upper back. It can cause stiffness in the fascia and tighten up the fascia, which is kind of like the wraparound of all the muscles, and it can have a pulling effect on your neck and back, like I talked about before, and that can result in pain. Next. So posture is a big one too. So if you already have poor posture, and poor posture can actually happen when you're stressed out. You know, when you're stressed out, you tend to be very depressed, your head shifts forward, your shoulders tend to slump forward, and that now causes stress, mechanical stress, on the joints of your neck and back as well. Couple that with psychological stress, whether it's anxiety or stress or tension from everyday life or whatever it is that you're experiencing, those things now become a vicious cycle themselves. So research has shown that good posture, sitting straight, having a plumb line drop from your head down through your pelvis, more like the picture on your far right, as opposed to the pictures on your far left, that can help reduce stress, not just psychologically, but also mechanically on your spine as well. Next. And incidentally, before I talk about this one, the issue of posture, our physical therapist, Melissa, is actually going to talk more about that in a few minutes. So I'm going to hand this over now to our nurse practitioner at our program in the Back and Neck Pain Center. She has a lot of experience in dealing with this and helping patients with this. So I'm going to hand it over now to Caitlin Condell.
Hi, everyone. So today I'm going to talk to you a little bit about mental health and stress. We'll talk a little bit about nutrition and exercise and some of the things that we can do to really help recognize when you have stress that's affecting your mental health and your physical health, and how we can, work to prevent issues in the future. So we all experience stress sometimes, but we don't always consider the effects of chronic stress on our overall health. As we discussed earlier, events and interactions in our everyday lives can cause us to experience stress and mental health issues such as anxiety and depression. And when we are in an ongoing state of stress, there are very real effects on our mental health and our physical health. So some of the ways that chronic stress impacts our health are listed here on the screen. You see the emotional symptoms of chronic stress includes irritability, anxiety, depression, lack of motivation, restlessness, moodiness. And some of the physical symptoms of chronic stress include headaches, insomnia, high blood pressure, digestive issues, change in sex drive, and muscle pain and tension, which is what we're talking about here today. Next slide. So now that we know some of the ways that chronic stress can negatively affect our well-being, how can we work to reduce our stress levels on a daily basis? That's really the big question. So some ways that we can minimize stress include setting a schedule. Putting your plans on paper can show you how realistic they are with your time availability. Can help you see when you're trying to do too much, and you can really just try to make your schedule more doable for you and take out some of those things that are causing you extra stress. That also allows you to carve out time to rest, decompress, and practice self-care in between activities. Eating a healthy diet, eating a healthy anti-inflammatory diet has a positive effect on your physical and psychological health, and we're going to talk about that a little bit later in the presentation. Exercising regularly, very important. Developing good sleep habits. So sleep loss can make it really hard to manage your stress levels. Aiming for 7 to 8 hours of sleep can help to manage your blood sugar, your appetite, and your stress level, keep them all at a normal level. Changing your expectations. So it's really easy to get overwhelmed by too many responsibilities, activities, when you're trying to do it all. So deciding which things offer you the most positive impact on your life helps you to recognize things that you can eliminate, things that weigh you down, and allows you to spend your time engaging in things that you enjoy, more so have a positive effect on your well-being. Stress reduction therapy. So mindfulness-based stress reduction. We're going to go over this on the next slide, but this is really interesting. And then breathing, meditation, and yoga. Sometimes it's really important to just stop and take a deep breath and give our bodies the oxygen that it needs. So pausing for deep breathing can help to reduce your level of negative stress. Taking the time out for meditation and yoga can also amplify this effect even further. Next slide. Mindfulness-based stress reduction. So this is a meditation therapy that's designed for stress management. A recent study actually demonstrated that this technique can help to reduce back pain and improve emotional control by increasing brain blood flow to the frontal lobe. Mindfulness-based stress reduction is used for treating a variety of illnesses such as depression, anxiety, and chronic pain. Practicing mindfulness involves activating a brain relaxation pathway. So it does this by deliberately ignoring the mental chatter and helps you to focus on your breathing. And that's where the stress reduction comes into play. Some examples of mindfulness-based stress reduction includes deep breathing, body scan meditation, walking meditation, mindful stretching, and yoga. Next slide. So these are two of these mind-body tools that promote mental wellness. So focusing on one's mental wellness is an important factor in reducing pain and addressing mental health issues, stress, anxiety, depression, as we've been saying. These two tools help to promote that mental wellness. So on the right, we have included a graphic of some yoga poses that you can perform right at home, from your office, from your dining room chair, just things that help you to get into that flow of, mind-body awareness and wellness. And then on the left here, we have a depiction of body scan meditation and some of the benefits that body scan meditation provides. So body scan meditation is great. It involves taking 10 nice deep breaths and then focusing on different sensations in your body, starting from the head down to the toes very slowly, and just being mindful in that part of your body at that time. And that can really help to provide a lot of benefits. Next slide. So now I'd like to talk to you briefly about the role of diet and nutrition as they apply to the reduction and management of inflammation and pain, which is really important when we're thinking about stress and musculoskeletal conditions that cause pain. So on the left here, you can see lots of bad food, foods that are not really the healthiest foods in the world, foods that actually promote inflammation in the body and promote weight gain, while providing very few nutritional benefits. And then on the right here, you can see fresh, colorful produce that are high in antioxidants, vitamins, and minerals. And these actually serve to reduce inflammation in the body. Research shows that our diet plays a significant role in inflammation and pain in the body. And inflammation is a really important underlying mechanism for the development of chronic diseases, including type 2 diabetes, heart disease, arthritis, and cancer. And increased inflammation in the body is also found in patients with chronic pain. So recognizing these foods that can reduce inflammation, that can cause inflammation, allows us to make diet modifications that can overall decrease the inflammation in our bodies and reduce our pain levels. Next slide. Okay. So the anti-inflammatory diet. So on the left here, we have the food pyramid for the Mediterranean diet, which is an anti-inflammatory diet, and it provides an excellent guideline for how to make diet modifications that will reduce inflammation in the body. So inflammation in the body can either be positively or negatively affected by the foods that we eat. Pro-inflammatory foods, or foods that increase the inflammation in the body, include foods like saturated fats found in meats, especially red meat, and whole fat dairy. Trans fats, which are found in hydrogenated oils used to make processed or packaged baked goods and crackers, so all the things in the middle of the grocery store. Omega-6 fatty acids, which are found in oils such as corn oil, safflower oil, soybean oil, and in sugar and sugar-laden foods. Whereas anti-inflammatory foods, which can help to reduce inflammation markers in the body, include foods that are high in things such as omega-3 fatty acids, which would be canola oil, walnuts, and fish, monounsaturated fats such as olive oil, peanut oil, nuts, and avocado, fruits, vegetables, and whole grains. The more colorful, the better, and many different herbs, spices, and teas that we have here. All right, the role of exercise. So I'm just going to briefly touch on this, and our physical therapist will go over exercise a little bit more later in the presentation. But as we've said, exercise is crucial to reducing stress, preventing and treating back and neck pain. So the way that exercise helps is, when you exercise, your body releases endorphins, which are feel-good hormones that are natural stress relievers, and these help to stabilize mood, decrease tension, and improve sleep. So, like I said, our physical therapist will go over this a little bit more, but you can definitely get a boost of positivity by just taking time to do a little bit of exercise in the day. For now, I'm going to pass you on to Dr. Ben Eliahus, who is going to discuss some of the treatments available for stress-related back and neck pain.
Sorry, thank you very much, Caitlin. So what are you supposed to do if you develop this back and neck pain that happens as a result of long-term stress or anxiety? Well, some of the things you can do at home are rest, ice, and heat. You can stretch. If it becomes insurmountable, where nothing that you're doing at home is making a difference, there are some modalities of therapeutics that can help. That includes physical therapy, chiropractic medicine, acupuncture and massage therapy. This all gets kind of navigated here by Caitlin at the Back and Neck Pain Center at our hospital. And then for serious red flags, which are very rare and probably not so much for this particular audience, but if it should ever develop, that would require an emergency room visit here at the hospital, and that would include fever, bowel and bladder, loss of function, saddle anesthesia, significant motor weakness where you're losing balance and you're kind of giving way, progressive loss of sensation in your extremities, or just severe chronic unrelenting pain that's just progressively worsening and you just can't function. Those are rare instances. We call those red flags, but we always want to have that evaluated at an emergency room. Next. So ice and heat, this is a pretty good chart that helps you understand, but the basic principle of this is when you have an acute injury, always use ice. It's interesting to me that I've been in practice for 37 years, and for some reason, people think that the back, it doesn't apply. So if I ask them, if you sprained your ankle, what would you put on for the first couple of days? The answer is almost everybody gives is ice, which is correct. When they come in and they have an acute back injury or back pain, most likely they're always coming in and they're telling me that they're using heat. The back is no difference. There's no difference. You need to use ice on your back in an acute injury as well. Once it goes to a chronic stage, you can use heat. And sometimes there are exceptions when there's a lot of muscle spasm and a lot of pain and inflammation beyond the first couple of 2-3 days. Ice, sometimes I'll recommend ice even in a back injury as well. But this is a pretty good guide. Next slide. So I want everybody to take a moment here to go ahead and just take a look at this particular tool that we use in clinical practice. It talks about pain, it talks about stress and anxiety related to your pain, and I'm going to give you about 60 seconds just to kind of either mentally or just jot down how many of these 9 questions you answered yes to. So let's wait a few seconds and I'll give you the chance to go ahead and answer them. And it'd be interesting, in the Q&A section on the bottom, if you'd like, you can actually put in your number so I can get an idea of, how many people are experiencing what number that they're experiencing. If you're not comfortable doing that, that's okay too. I'm going to refer to this at the end though. So we'll give everybody a couple of minutes. And then I'll refer to this, and you could go ahead and add it on later as we go along as well. But there are 9 questions, and then I'll give you another 10 seconds. Okay, so let's go ahead and move on. So what are some reasons for back and neck pain from an anatomical perspective? So we're just going to briefly go over this. On the far right, you can see multiple red dots all over muscles. So that's one reason for pain, particularly with people who have chronic anxiety or stress. We tend to be very uptight. Our shoulders become up by our ears. Those muscles up in the top by your neck and traps become extremely tight. They develop things called trigger points, which are these red dots, which are kind of knots, focal knots within the muscle. They produce their own pain phenomenon. As you go more towards the middle scale, you can see the red stippled areas across the body. The X marks the spot for where that knot in the muscle would be, and it can cause pain, referred pain, away from where the knot is. So local muscle spasm or local muscle knots or trigger points, they can cause not just local pain where the X is, but can actually mimic pain that's like a pinched nerve that shoots down your arm or down your leg. The art and science of being a good clinician is figuring out what the pain generator is, whether it's muscle, whether it's joint, whether it's arthritis. And there's lots of tests and different imaging techniques that we use to help us make that pinpointed diagnosis. It's kind of like a target. You know, if you're kind of shooting an arrow at a target, but you're blindfolded, chances are you're not going to hit the bullseye or anywhere near the target. So we like to be able to figure out, you know, what's wrong with someone so we can generate our therapy or our advice towards the bullseye, which is the pain generator. On your far left, there are some etiologies of pain. They could be the facet joints, which are the little joints inside the spine. They could be arthritic. You can have disc pain, which are the pads between the bones. And then lastly, on the very, very bottom left picture, something called the sacroiliac joint, which can be an acute cause of pain as well, and can happen from people sitting a long time. Sitting has been considered the new smoking. And because when we sit a lot, especially in this pandemic times, when a lot of people are working from home, they're sitting at their computer for hours on end, looking at a computer screen, it can definitely cause increased back pain and increased postural strain, and then increased muscle spasm. Next. So here are some conservative and non-invasive treatment options that we recommend at the hospital. You can see on the left is physical therapy, on the right is chiropractic medicine. I'm going to talk a little bit about chiropractic medicine, and Melissa, the assistant director of PT here at the hospital, will go on about PT. So different types of, I don't know how many people have been to chiropractors. I'm sure some of you have. There are different things that chiropractors do: spinal manipulation, low force type of therapy. If we look at the pictures, the very top left picture is the classical, for lack of a better way to say it, the cracking of the back technique. And by the way, nothing cracks when someone has that done. It's just a popping noise. As the joint separates, gas escapes, and it creates that noise. For some people, it's an excellent technique. For some people, it's not a good idea at all. I usually go into that, but we'll go into that another time. The right-hand picture is an activator tool. That's just a type of popping gun that helps to move the joint. And on the bottom is a Cox table, which is a table that actually moves the joints very, very gently in different ranges of motion. It also distracts the disc, so it's very good for people with spinal stenosis and disc issues. Next slide. This is a better picture of the Cox table. You can see his left hand sits on a bar. That table will now be pushed down. His right hand is holding the joint and the disc. And research has shown through CAT scan studies that this type of distractional technique reduces intradiscal pressure and also mobilizes the joints without having to do that high velocity cracking technique, so to speak. Very safe. And these are just a couple of studies that have been recently published. The AMA, if you had asked people 25 years ago what's their opinion of chiropractors, they would have said, oh, stay away from them. No research, dangerous. But there's been a complete 180 by the AMA. The study on the right, just real quickly, was a study of people in the military. And what they found was that chiropractic and medicine together actually created a better effect at reducing back pain than just usual medical care alone. So you can see there's been a huge 180. It's covered by all insurance companies now. And most big agencies, including the AMA, the FDA, the CDC, all recommend chiropractic care now for back pain. So I'm going to hand this over now to Melissa. Melissa's going to talk about PT as an option for chronic back pain, and she'll talk about posture as well. Melissa?
Hi, good afternoon. My name is Melissa Hafner. I'm one of the physical therapists and assistant director in the outpatient physical therapy area. We are a full-service outpatient clinic treating a wide range of diagnoses such as neurological conditions, post-surgical conditions, balance and vestibular disorders, a wide range of orthopedic injuries, and many other diagnoses. One particular diagnosis for neck and back pain that's closely associated with stress and often brought on by stress would be postural dysfunction. Postural dysfunction, repetitive bouts of stress can often cause musculoskeletal dysfunctions, as Dr. Ben reviewed earlier. When the body is stressed, it becomes tight, more inflexible, making it difficult to regain the relaxed or proper posture that we strive for. So poor posture leads to faulty mechanics of your spine and can often lead to pain. Therefore, stress can cause or enhance back pain with increased intensity and happening more frequently. Next slide, please. Thank you. So poor posture at any level can really lead to muscle imbalances. A muscle imbalance is when one side of your body, the muscles are maybe a little tighter, a little stronger, a little weaker compared to the corresponding muscles on the other side of the body. And that's how you get that imbalance. There are common muscular imbalance patterns seen in the clinic. Two examples would be the upper cross syndrome and the lower cross syndrome, which are the pictures that are depicted on the right-hand side. So the upper cross syndrome, the top picture is more in relation to the head, shoulders, and neck posture, whereas the lower cross syndrome really refers with the back and the hip region. Often it's showing where the tight muscles are and where the weaker muscles are. The tight muscles really have been overused and shortened over time, and we need to get in there and stretch and promote mobility into those tissues. We could do that in many different ways, and we'll review that in a little bit. The elongated muscles have really become inhibited, underused, and have become pretty weak. So then at that point, we have to try to facilitate that proper posture and strengthen those muscles in that proper posture. So the good news is there's no wrong time to start postural correction and start strengthening to help with that alignment. So after an evaluation and a thorough sitting and standing postural assessment, then we can go into implementing a stretching and strengthening program. Really, that program would focus a lot on your core stabilization, which helps support the spine and promote that erect posture. Endurance exercises, a lot of your postural muscles need to be used for a prolonged time, so endurance exercises are important to put into the equation as well. We do focus a lot on teaching postural awareness. It's teaching the body as well as the patient how to maintain that alignment as they're going through specific movements that they may have to do throughout their day. So at that point, sometimes we would ask our patients to go home and assess when they find themselves in poor posture or when they're in discomfort. And that feedback helps us to be able to give them ideas for their home and work situations. Often we can offer some modifications or suggestions for ergonomics at their workstation, in the car, or while they're sitting on the couch. So the feedback of the patient really dictates where we can go with the sessions. While we do offer many of the traditional treatments that you may have received in the past or heard of in the past, therapeutic exercise play a big part of our treatment sessions, really focusing on core and postural muscles, the stretching and strengthening for that. And as you progress, we do try to add some aerobic and endurance activities. Manual therapy, especially in the beginning, we just talked about those tight, overused, very stressed muscles, getting in there with some soft tissue mobilization, myofascial release, or manual stretching is initially very important, trying to elongate those fibers that may have shortened over time. The Mckenzie Method is something we very commonly use in our clinic. We've seen great results with it as well. It's when a patient would go through a series of repeated motions to counterbalance some of that stressed or poor posture, that prolonged posture that we tend to sit in. So maybe we would do an example of that would be like a slouch overcorrection and teaching patient's proper alignment with that. Sometimes we do repeated extensions or repeated retractions, and that's something we can get into with the sessions. Modalities do find a place in the clinic. Sometimes initially you may need some heat, ice, electrical stim, or traction, and that can be used in conjunction with some of those other techniques. So once we've helped reduce your pain, improve your range of motion, then we get to focus on some more functional activities, whether it's returning to work, getting back to the gym, or maybe any other hobbies or activities that you may have been avoiding or stopped because of your neck and back pain. As we near the end or plan for discharge, that's where we'll change our focus onto more of a home exercise program, patient education, postural education, or lifting techniques. These are important towards the end of your treatment sessions, is because we want the patient to feel 100% confident in performing their exercises, so they feel like they can continue these even when they're done with their physical therapy. As if the reduced pain, improved range of motion, and function wasn't enough of a benefit, there are other benefits to completion of a physical therapy program. We often have patients tell us that it helps them jumpstart adding a daily exercise program into their routine. Many of our patients have come to us for 2 to 3 days a week for about an hour a session, and now they feel that they will implement the gym or something else to replace that time. So getting exercise into the routine right after therapy is very important. We educate on proper body mechanics for working out, so this really helps boost the patient's confidence for maybe strength training or adding exercise in for the future. A lot of these patients have come to us, they may have never lifted a weight in their life or did any exercise, and now we have educated them on how to use the machines and how to, slowly go through their repetitions, that they feel a lot more confident in working out. Throughout therapy, we try to empower the patient to take ownership of their health and their back and neck pain, overall trying to play an active role in their recovery. We've hopefully educated you throughout the time that you felt comfortable and understand your diagnosis or disease process as much as possible. And hopefully by the end of therapy, you're understanding the importance of exercise and stress reduction. It was discussed earlier with Caitlin, the effects of exercise on the body. So the release of those endorphins are very important for that feel-good feeling that you can often get after exercise. So there are studies saying that even 5 minutes of aerobic activity a day can really reduce the stress and tension in the muscles in you and improve your mood, and also improve your self-esteem. With all that benefit to the exercise, you're hoping it would break that pain cycle in the long run. With that being said, I'll turn it back over to Caitlin. Thank you so much for your time.
All right, thanks, Melissa. So I'm going to tell you a little bit about our Back and Neck Pain Center here. We do offer evaluation and treatment for back and neck conditions. So I'm going to tell you a little bit about how our Back and Neck Pain Center is different. So here at the Back and Neck Pain Center, we provide evidence-based multidisciplinary care, which is customized by a clinical team, which includes a collaborating physician and me, the nurse practitioner. So when I talk about multidisciplinary care, I'm referring to the fact that we have multiple providers from many different disciplines, which include spine surgery, interventional pain management, physical therapy, and chiropractic, who all work together to coordinate your care. So we actually have once weekly meetings, review patient charts to allow for providers from different backgrounds to weigh in on the selected treatment plan, and we each give our unique perspective. At the Back and Neck Pain Center, we also aim to reduce recurrent episodes of back and neck pain in the future. So we don't just want to fix your pain, we want to make sure it doesn't come back. And we do this by teaching about adopting a healthy lifestyle, including diet and exercise. At the Back and Neck Pain Center, we also avoid the use of high-risk pain medications. So while one of our goals is to alleviate your pain, we want to find the underlying cause of your pain and provide treatment that addresses this underlying cause. And with that, we do have interventional pain management doctors attached to our program. And sometimes if more invasive pain management techniques are needed, we can refer to them as well. And here at the Back and Neck Pain Center, we also identify and address disparity of care factors. So there are many factors that make it difficult for individuals to access treatment, and this includes financial obstacles, transportation issues, mobility issues, comorbid medical conditions, mental health issues, and difficulty managing multiple appointments with different providers. It can be overwhelming at times. So at the Back and Neck Pain Center, we try to identify these factors and provide assistance to ensure that you're able to get the treatment that you need. This is a graphic that depicts our stepladder approach, which is our approach to treatment at the Back and Neck Pain Center. So with this approach, we aim to provide the least invasive, effective treatment option for your condition. So for most people, this means starting with conservative treatment measures like physical therapy or chiropractic care. If you've already tried conservative measures without improvement, or if your condition warrants further intervention, we may start higher on the ladder with something like interventional pain management or one of our support programs, and that includes mental health and nutritional care as well. In cases where you have a red flag sign or symptom that indicates that you have an urgent condition, we may send you directly to a surgeon. So approximately 75% of our patients improve with conservative measures, but we continue to evaluate you throughout the course of treatment and recommend additional treatments or steps as appropriate. About 20% of our patients utilize our pain management treatment options, and about 5% of our patients have required spinal surgery. So our overall goal is to provide you with the most appropriate treatment for you, and treatment that will be effective in reducing your pain and helping you to regain function. If you have any questions about the Back and Neck Pain Center or the type of care we provide, or would like to reach out to us to schedule an appointment, we're going to be giving our contact information at the end of the presentation, and I'm always happy to speak with you and address any concerns or questions that you may have. So now I'm going to turn it back over to Dr. Ben, and he is going to go over the results of your risk assessment with you.
So if you go back and you just remember how many you checked off on that particular survey, generally if you scored 3 or 4 or higher, it's broken down into risk. So anything like a 2 or lower is considered low risk, meaning, yeah, you have some pain, maybe a little bit of stress, but nothing terrible. Anything higher than 4 would be considered medium risk, and anything higher than 5 is usually considered high risk. And what does that mean? That means that you have a risk factor with stress and anxiety, maybe even depression, that's kind of perpetuating your back pain and would require some attention. We can help you here at the Back and Neck Pain Center if you choose to reach out to us. I'll give you our contact numbers at the end. We take almost every insurance plan. Next slide. So just to review and in conclusion, I think we demonstrated that stress can cause, exacerbate, and perpetuate back pain. Recognizing the stressors in your life and managing them the best you can help prevent and manage the pain. Adopting healthy exercise habits and nutritional habits, utilizing stress management techniques, as Caitlin described, can also help manage that stress and pain. And if none of this is working and you still have chronic pain and issues, then treatment is available, and Caitlin would do an excellent job at helping you navigate to the right place and directing you to the most appropriate care. So again, the vicious cycle, you have to break that cycle. Stress is part of life. It's not something that you can ever avoid. From the moment we're born, and that's stress when we're first born, to the time that we're dying, it's just part of life and living. So it's not about eliminating stress, it's learning how to handle that stress. Caitlin gave you some good tools about how to handle stress on your own, but if that's not happening, you can reach out to us and we can help you more. The more stress there is, the more spasm there is, the more pain there is, the more pain there is, the more stress there is, and you can see how that's just a constant merry-go-round. So we hope you learned a lot today, and we'll answer some of your questions in a bit. Next slide. But if you want, before I start handling those questions, you can email us at that email address. If you want to make an appointment, you can call that number. You can call that number and you can get a hold of Caitlin or myself, and we'll be able to talk to you on the phone if you so choose. And there's a cute little cartoon on the bottom. And according to the latest research, the average human body is 20% water and 80% stress. Some people might think it was the other way around, but it's actually this way. So it's learning how to handle that stress, how to attenuate the stress and mitigate that stress, which can have a significant physiological effect on your body, as well as reducing any structural effects that your body's having as a result of that psychological or mental health stress. All right, so let's go look at some of the questions.
Thank you, Dr. Ben, Caitlin, and Melissa for that great presentation. Very informative. We do have a couple of questions here already, so I'll read them out loud to you and you guys can discuss who should take them. One of our first questions is, do you recommend prescriptions? And I think Caitlin touched a bit on that.
Yeah, I can elaborate a little bit on that. So certainly there are prescriptions available for all different types of conditions, including back pain, muscle tension, muscle spasm, and for things like anxiety and depression. So definitely in order to see if you're a good candidate for medication, we would have to do an evaluation and see what your complaint would be, whether that be a muscle spasm that would benefit from a muscle relaxant, or a mental health condition like anxiety or depression. For patients that come to our office, we do an evaluation to see if there are any signs of anxiety or depression or stress-related causes of pain. And if it's appropriate, we do, of course, recommend things that we discussed today, things like yoga, meditation. But we do have a mental health care clinic, and we do provide referrals to the mental health care clinic in the case that, I would feel that you would benefit from that. And then that would be part of the discussion if those kind of medications would benefit you.
Great. Another question here. Do you take Medicare and United Healthcare?
So as far as insurance goes, there was another one above regarding NISHIP as well. So yes, our center participates in Medicare, United Healthcare, as well as New York State Health Plan. So the answer is yes.
Okay. How would you get cured if your knee pops? I know, Dr. Ben, you've spoken before about like your legs being related to back pain. Maybe you could speak to that.
So I'll try and answer that one first, and then I'll let Melissa and Caitlin jump in afterwards in case I didn't answer or they have a different perspective. But knee popping without any pain or functional change in your ability to function with your knees, I personally wouldn't worry about it. My knee pops all the time when I bend down. It just makes a noise, and usually it's just gas escaping from underneath the kneecap. And it's really not a big issue. If you're having pain, that's another matter, and it would need to be investigated. But popping without pain probably generally sometimes means that maybe your muscles aren't nearly as strong as they should be. Melissa and Caitlin, you want to weigh in on that?
Yeah, I'll just say that, I agree with everything that you said, that, painless popping is not a terrible concern. Certainly if you have pain in your knee, I would recommend that you get an evaluation done. You have somebody evaluate your knee. Certainly we could do that here as well. If there are signs that there's something wrong, imaging might be warranted. And then there are treatments available, such as physical therapy, and of course, more invasive treatments if needed. If you want to add something, Melissa.
I pretty much was going to say the same thing as far as if they even had an evaluation or anything. There's several causes for popping in the knee, but then I would go with Dr. Ben as far as the muscle imbalance or weakness in the knee. Sometimes the tracking of the kneecap can be off. So it's very hard to give, we're giving just general answers without an assessment. It's very hard to just give you a blank one statement. But great question.
Great. We also have, is an extra firm mattress better than a spring mattress to alleviate back pain, or is there any positive role of a Tempur-Pedic bed in relieving back pain?
So mattresses are, we could talk for a half hour about mattresses, but just to give you an idea, if you're having chronic back pain, you're waking up with back pain every morning, it could be related to your mattress. Tempur-Pedic mattresses are excellent. And mattresses are a very personal thing. Without getting too far in depth, I personally use a Tempur-Pedic mattress and like it a lot. But I have friends who use other ones that love it. It really comes down to, does it properly support you? Do you wake up without a backache in the morning? And if you could think about this concept, if you were to lay on your side and the mattress had enough firmness to it, yet enough give to it, so that if we were to look at you from the side, your head, your neck, your spine would be one straight line parallel to the bed, that's considered a good mattress. Whether it's Tempur-Pedic or Casper or Purple or Sattva, honestly, I don't really tell people which actual mattress to buy. I tell them that they should try it and see how it lines up their posture. Because if it's sagging too much, if it's too soft, like Tempur-Pedic happens to make a product that's called the Cloud, and in my opinion, that's way too soft. So I always tell patients that a medium firm mattress that's firm enough yet soft enough to keep you in that proper alignment is the right one. Melissa, do you want to add to that?
I agree a lot with Dr. Ben. I feel like mattresses and pillows are two of the hardest things to give a one recommendation to all the population. It is something you do have to try. Everyone's body's a little different and their curvature is different, so you need different supports. But Tempur-Pedic, the medium, is usually what I recommend as well, and that's what I have at home. But again, you're different, so just make sure there's a trial period or maybe somewhere that you can go try it before you buy it. All right.
Caitlin?
Yeah, no, I mean, yeah, I agree with everything you both just said.
Great.
Yeah.
We had somebody who logged in late and asked if we're going to be able to view this at a later time. That answer is absolutely. So everybody who's attended will get a follow-up email in a couple of days once the recording has been uploaded and gone through. So you'll get an email from us in the next couple of days with that. We have, let me see, neck and shoulder pain, mostly when laying down. Could you guys advise on a course of treatment for that?
Certainly, we would need to evaluate anyone before advising a specific course of treatment. There are a lot of different causes of neck and shoulder pain, especially when lying down. So that would be something that we would encourage you to get an evaluations on, but definitely can be treated with many of the different modalities that we discussed today. I don't know if you guys have anything to add, but certainly we need to see what the cause was by doing a thorough evaluation.
I would agree.
Great. We have another one. Can you help an anxious person who also has rheumatoid arthritis? I have stiffness in the right side of my neck going down my right shoulder and towards the rhomboid area.
So I'll take that. Yes, absolutely. We have a lot of patients who have comorbid medical conditions, rheumatoid arthritis, many other conditions, and certainly people who have anxiety and depression because it goes hand in hand with pain. So definitely, it sounds like you would be a good candidate for an evaluation and treatment. Definitely something we would need to see, what the best course of treatment would be for your specific condition, but definitely something that we treat, something that we've had treated in the past.
Yeah, I would say I would agree with everything Caitlin said. I mean, rheumatoid arthritis is a special population which needs very personalized approach. And I'll let Melissa jump in on that because I'm sure she's seen patients in PT. And I think most people would probably worry that, oh my God, they're going to put me on machines in PT. It's going to be bad for me. And I'll let Melissa talk about how they handle patients like this in their department.
Again, a thorough assessment would need to be done to see what is needed at the moment. But I mean, we do try to start patients off slowly, again, more with the modalities and soft tissue stuff, and try to wean them into some exercise and strengthening. But patients' feedback throughout all the sessions are encouraged and important to dictate if we're going too fast or too slow for patients. Again, everyone progresses a little quicker, and their status when they're coming in are very extremely different. So your feedback as a patient, you're your own advocate. So telling us what's too much, too little is important to us as well. Is that the
Yeah, that's great.
Oh, okay. Sorry, I didn't know if I answered exactly what you were looking for.
No, that's good. And we have 2 more questions here. So maybe, Caitlin, you could discuss about the COVID precautions you guys are taking to make sure that the office is safe for people who come.
Yeah, absolutely. So when you call to make an appointment with to be seen by me at the office or at physical therapy as well, you're screened by our patient access personnel to make sure that everyone who comes into the building has had a thorough screening to make sure there hasn't been any recent travel or any fevers or any signs of illness or exposures that they know of in the past. When patients come in, we call to confirm them. We make sure we have minimal people in the waiting room or really no people in the waiting room to try to keep any kind of exposure down. All temperatures are checked, masks are provided for all patients, and they're asked to Purell their hands. And we really try to keep the number of people that we have to a minimum. So we don't have overlapping appointments at the Back and Neck Pain Center. We really space out the appointments. And another thing that we're offering currently because of COVID is we do have telemedicine exams available. So we do encourage you to come into the office for a first appointment so we can, actually see you hands-on, and evaluate your condition. But certainly for follow-up appointments, we offer telemedicine sessions via Zoom, which also minimizes the amount of people we have come in because the majority of our follow-up sessions are conducted via telemedicine.
Perfect. And also, do you require a doctor referral for evaluation and or treatment?
No, we don't require referrals. I don't believe any plans that we see require them. Is that correct, Dr. Ben?
Correct.
Yeah.
Yeah, as a nurse practitioner, you have direct access to Caitlin.
All right, and I see one more here. I have shoulder, arm, and neck pain. I think this can be addressed by the information you guys presented. I also wake up with numb hands often, but not always on the same side. Any thoughts on this?
Yeah, I can take that. So certainly there are different causes of numbness in the hands. When there is concurrent neck pain, something that we look for is that there could be a possible nerve entrapment, whether that be a nerve in the cervical spine, causing what we call radiculopathy. I know Dr. Ben briefly touched on that. Or, there could be peripheral nerve entrapment that could cause numbness. It's something that we could evaluate to see really where that's stemming from. But definitely numbness in the hands could be related to the neck pain. I don't know if you guys want to add anything with that.
Yeah, and the other thing that can happen is people can have both. They can have a pinched nerve in their neck that's responsible for those symptoms. They could also develop carpal tunnel syndrome based on your occupation or what you do for a living. And some people have both. I've seen that happen many, many times in my career. And a good clinician would help differentiate whether or not you have one or both, and then direct the proper therapeutic advice for obviously helping and alleviating both. So, like I talked about with the bullseye and the target, you have to be able to generate and figure out what the pain generator is. And in this particular scenario, certainly sounds like a pinched nerve in the neck, which Caitlin would certainly be able to help you with. But it could also be carpal tunnel syndrome on top of that. So those are the kinds of things that we're really good at discerning at this center.
I agree. I would have described it the same way as Dr. Ben. Multiple reasons for it, and differentiating it is important on one of those initial sessions.
Great. I'm just looking over to see if we have any more, because it looks like we have covered all of the questions asked here. We'll give it about 30 more seconds. If anybody has any further questions, please feel free to enter them in the Q&A at the bottom of your screen. All of your questions are anonymous, so protect your privacy as always. Somebody says they are a patient at North Shore University Hospital. If he signs or she signs a release, would you be able to access their medical records?
Yeah.
Yeah.
Okay, great. It looks like we've covered all of the questions here today. Dr. Ben, would you like to wrap us up?
Yeah, so I want to thank everybody for attending. We hope you learned a lot about, I think we've given you some tools on things that you can do at home. But typically people who develop stress and anxiety, especially in these particularly challenging times that we have now, of not just, worrying about COVID-19, getting the vaccine, getting tested, staying home, quarantining, stressful in and of itself, let alone the other stressors of life that we talked about before. And then the last stressor of many people working from home, being on the computer all day long, sitting like this, posturally creating stress. All those things can contribute greatly to back pain. In fact, we didn't talk about this, but I recently read a study that talked about the increased incidence of back pain and neck pain related to the people working at home has increased significantly in the last year. So much so that many more people are actually seeking care, but are frustrated by the fact that because of COVID, they can't get the care that they need. And the point that Caitlin made about telemedicine is a valid one, that even if you're still concerned about going out, we can kind of help you through telemedicine. So I want to thank everybody for attending. I know your time is valuable. I hope we gave you tools to use at home, and reach out to us. The numbers are still posted. Caitlin and I are happy to talk to you at any time, answer any questions via email, and everybody have a great day. Thank you.
Thank you.